Hi, I'm Dr. Danesh. I wanted to answer a very basic question to what we do every day. What is regenerative medicine? You may have heard of athletes who get injured on the field and then they go away for a few weeks and they're back on the field better than ever, and they attribute it to stem cell injections. Well, that is one form of regenerative medicine. It's the sexiest form because it sounds cool. You're using stem cells to regrow essentially a joint. And while yes, that is feasible, there's a wide spectrum of things that we can do with different aspects of regenerative medicine. In its most fundamental form, regenerative medicine is essentially using the body's capacity to heal itself or regenerate in an amplified fashion, in greater degree than what the body is capable of doing on its own. As we age, what we're used to as children is that as soon as you get hurt, the next day you're back to normal. And part of the reason is that when you're young, you've got a vast supply of stem cells just lingering in the body. And as soon as there's an injury, they mobilize and they get things fixed. But as we age, we lose the number of, or the density of stem cells in our body. So it becomes harder and harder and slower to heal from injury. And oftentimes you get a small injury that then has a domino effect, because if that one issue isn't fixed, it will accumulate and cause stresses down the mechanical chain. And so other things start to break down. And one of those components or multiple of those components may be what's causing pain. So oftentimes in healthcare, what we do is we try to reduce the inflammation, but really inflammation is just the first step of healing it from an injury. When you get injured, inflammation is what gets your body in the process of healing, but then that inflammation stimulates the stem cells in the area to start proliferating and start recruiting other cells to come into the area and start repairing the tissue. And progressively they regenerate, and your job is to rehabilitate so you get everything back to normal function. But a lot of things in healthcare actually hinder that inflammatory process. Inflammation we think of as the enemy, and it's not. It's really a helpful process. It's just that pain and inflammation go hand in hand. Inflammation sensitizes the body and causes pain. And so while certain treatments, certain medications might help with the pain, they may actually slow the inflammation and hinder the healing. So it's not always the right thing to just dose it with anti-inflammatories, use ice. Those are some outdated treatments. In fact, Dr. Milken was the sports medicine doc who came up with the whole RICE, rest, ice, compression, elevation. And even he's come out and said that, look, we got things wrong. Inflammation was not the bad guy. So regenerative medicine is essentially understanding in what situations your body needs that inflammation, helping your body optimize the use of inflammation, and essentially proliferate the stem cells that are in the area, or mechanically bring in stem cells. And really it falls into three different categories. The most basic form is prolotherapy, which is essentially using medications to stimulate that inflammatory process. Then there's PRP, which is what people hear about on TV with athletes a lot, and that's platelet-rich plasma, or using various growth factors in your body to stimulate the migration of stem cells into that area. And then the third is just to mechanically take stem cells, whether it's your own, from bone marrow or from fat cells, or from embryonic tissue, not actual babies, but the byproducts of birth, can be processed and used as another growth support for your own body's tissues. So that's the basic of what regenerative medicine is. If you have any other questions, feel free to reach us at wellwardmed.com, or just send us some questions on this video and we'd be happy to address them. Thank you. Have a good day.